A very good evening to one and all. Welcome to the webinar series by Dr. Shika's Nutri Health. And in today's webinar, we are going to be discussing the challenges of colorectal cancer. So to discuss that, today with us we have Dr. Mudhasir Ahmad. Dr. Mudhasir is the senior consultant, a medical oncologist in the International Oncology and Fortis Hospital, Noida. He has completed his MBBS and MD from GMC Srinagar and SKIMS Srinagar, and later has trained in medical oncology, hematology, and blood and marrow transplantation at Indraprastha Apollo Hospital, Delhi, and Apollo Hospital, Hyderabad. He is certified from European Society of Medical Oncology (ESMO) since 2014 and DNB Delhi in 2015. He has several research papers in reputed national and international journals. He has attended preceptorship programs with ESMO on immunotherapy from Prague and lung cancer, Singapore, and uro-oncology workshop from Veterans Hospital, Taiwan. He has the honor of receiving ICMR grant for research presentation in World GI Congress in Barcelona. His main interests are precision medicine and immunotherapy in thoracic, breast, and GI cancers. Welcome, Dr. Mudhasir, to this webinar.
Thank you.
Our second speaker for the day is Dr. Shika Sharma. Dr. Shika Sharma is a medical doctor by training from Maulana Azad Medical College, New Delhi. She founded Dr. Shika's Nutri Health with a desire to work in the prevention of lifestyle-related disorders. The organization is a pioneer in integrating modern nutrition with Vedic nutrition and serves clientele across the globe. She has built a telenutrition center and a personal health app called Vedic Diet, which helps in delivering personalized advisory and compliance monitoring, another pioneering concept introduced in the area of wellness. Dr. Shika had a weekly column for 11 years in the national newspaper HT Brunch. She has also been quoted by several leading newspapers and magazines like Times of India, Femina, Cosmopolitan, Economic Times, etc. Dr. Shika appears regularly on television channels like NDTV, CNBC, Zee Business, and others. She is invited frequently for giving lectures and talks to economist magazines, ASOCHAM, and top Indian institutes like IITs and IIMs. Dr. Shika was written about by India Today in its article Top 50 Young Achievers of the Country. She is also empaneled as a lead expert with FSSAI, which is Food Safety and Standards Authority of India. She has been the health advisor to many celebrities, hoteliers, chief ministers of Indian states, and one late prime minister, amongst others. Welcome, Dr. Shika, to this webinar.
Thank you, Nitin, for the moderation and for the introduction. So today, of course, it's a delight to welcome Dr. Mudhasir. He's a fellow doctor, but he's also a fellow Kashmiri from my state, and it gives me double the pleasure. So, Dr. Mudhasir, welcome to this panel as a honored guest. So, the first question which I will ask you is that we all know that cancers are rising globally, and today there is a lot of talk about nutrition in cancer, environmental influences in cancer, and in fact, epigenetics has also come up in cancers. So, how important is early detection, and what are the signs and symptoms of cancer which can be detected early, and what should be people alert? I mean, what are the things they should be alert of?
Thank you. Thank you for inviting me to this panel. I think it gives me a pleasure. As you said, we are from the same state, so and same part of the state also. So, so talking about cancer, unfortunately, as the life expectancy of the humans is increasing everywhere. The disaster like cancer we are seeing it more and more. So this is probably one of the reasons, that because we are living longer as compared to what was the life expectancy like 50 or 70 or 100 years ago. So probably we are living double now what the people of same age would have lived in 1920. So that is one reason. So another reason is that probably because of the changing lifestyles and changing dietary habits, changing obesity. So probably the world has never seen such an obesity which we have now. So previously we used to see that the people are dying of lack of food. Now the people are dying of actually more food. Talking about the colon cancer is one of the most common cancers all around the world. In India, every year we have about 50 to 60,000 new cancer patients. So it is actually, it's a huge, weight on the resources of the country, resources of the hospitals, government hospitals, and private hospitals alike. Uh, we being a country which has less actually social, we can say, the social support for the treatments. So most of the cost comes from pocket. Out of pocket expenses are the most in India. So this becomes very important to detect cancers early and treat them with early, so that the treatment is less costly as well as more effective. So what are the causes of colon cancer? So let us first talk about the presentation, as you said. So the presentation, we have to know that this cancer, colorectal cancer, is the cancer of older people. Older people does not mean old age, does not mean kind of very old people. It means the incidence increases significantly after the age of 50. Okay, so this is in on an average, but there are some patients who may present at a very early age. For example, today I saw a patient who was just 26 years old and had a colon cancer. So the colon cancer can happen at any age, any adult especially, but more commonly seen after the age of 50. The most common presentation depends upon which part of the intestine it happens. For example, if it happens on the right side of the right part of the intestine, right side of the intestine, so the most common presentation is usually anemia. The hemoglobin becomes less. So that's why it becomes very important that the anemia, whosoever has any unexplainable anemia, they have to be evaluated. They have to be evaluated with the help of blood tests, as well as, if needed, the upper GI gastrointestinal endoscopy or the lower GI endoscopy, also known as colonoscopy. So anemia is one of the presentations. Another presentation is the patients may have the altered bowel habits. They may have like alternating diarrhea and constipation. They may have bleeding in the stools, which may be visible, quite visible. They may have cramps. They may have bloating, which may remain for a long time, which is not correctable with the normal usual medicine. So these are the most common presentations.
Exactly. And I think what is also important is that because it's colorectal cancer, and because, people think, oh, aaj kuch kha liya, or I've eaten something, so it must be that. People tend to ignore and neglect it far more compared to other kind of cancers, where you can feel a lump, or where you can see more prominently the kind of cancer. So when we look at colorectal cancer, what is, suppose there is a diagnosis and somebody has blood in the stool, or somebody has changed bowel habits, so what is the first step? What do they have to really do if they need to get evaluated?
Okay, so regarding the evaluation always starts with the primary physician. So you see, this patient will not come to cancer specialist or a surgeon, or he will be seen by a primary specialist, by an MBBS doctor or an MD doctor somewhere. So that doctor has to know well, and they have to ask very relevant questions about the anemia. When did it happen? What are the other signs along with anemia? Are there any other features which are pointing towards something? Okay, one more presenting feature is weight loss. Unexplained weight loss, unintended weight loss is one of the, nowadays, if somebody loses weight, they will be happy. Of course they will be happy. People pay to lose weight. But if somebody is losing weight without spending money, then they should think that they are probably, that there can be something very awful, like cancer. So they have to know that. Regarding the evaluation, so evaluation always starts from the physical examination, which will be done by the doctor. We will also be doing some blood tests. There are some general blood tests like the hemoglobin level, etc., and there will be some specific blood tests like the tumor markers. Sometimes we do it if we suspect colon cancer. The first investigation, usually after we suspect a case of colon cancer, is usually the colonoscopy. Colonoscopy is nothing but a video examination of the lower part, of the terminal part of the intestine, probably terminal around 1 meter or so part of the intestine. Okay, the from the terminal, like the sigmoid colon, the descending, ascending, and the transverse colon, the large intestine, which we say. So the colonoscopy is usually the first investigation, and that usually detects if there is any mass or any polyp or any growth anywhere in that part of the intestine. We do some other tests also at the same times. For example, detection of blood in the stool, so which can be done by the fecal guaic testing, fecal blood detection. One is called as occult blood testing. There are some advanced tests also available, which is called as, for example, fecal immunochemical testing. So that is also one of the things. Sometimes we do a video colonography, computed tomography of the colon, which actually which makes a virtual colon, and we can detect some abnormalities inside the colon.
Correct. So, doctor, like we know that cancer was considered dreaded disease. So, what are the generally outcomes in connected with detection? Like, if say one detects it at a certain stage, what is the outcome? Or the next stage, what is the outcome? How long can, I mean, what are the what is the situation if somebody is diagnosed? How long they can live, and what is the outcome generally nowadays?
So we call it prognosis. So what is prognosis? Prognosis is how long a person would live after the person is diagnosed with colon cancer. So how do we know it? How can we prognosticate, or how can we tell a particular patient how long, on an average, how long he or she may live? We need certain things before that. So that is called as staging. Staging is very important. So by stage, I mean how small or how large the cancer is. Is it localized at only one location, or is it like spread all around the place? Then, if the stage is early, for example, it is stage 1, that is, the tumor is only present inside the colon, there is no other tumor anywhere else in the body. If it is such, then this is called as stage 1, and virtually we can say that most of the patients, like more than 90% of the patients of stage 1 would be cured. By cure, I mean that the cancer will go from their body and will never come back for the whole lifespan of the patient. And the person, everybody has to die, but this person will not die because of this cancer or its treatment. So and the treatment is surgery mostly, and we do not give any more treatment after surgery in case of stage 1. Then comes the stage 2. For example, if the tumor is a bit larger, or if the tumor involves the surrounding areas, or nearby lymph nodes, if it goes to nearby lymph nodes, if such is the case, then we call it stage number 2 or stage number 3. In stage number 2 also, that the prognosis is very good. More than 70-80% of the people will be cured. In stage number 3, we need to give some more treatment. Most of the times we need to give some more treatment in the form of chemotherapy for a few months. But after that chemotherapy, many, we can say majority of the patient lives long, and the cancer is curable. This is all we are talking about stage 1, 2, or 3. But when we come to stage 4, that means the cancer has spread beyond the local or loco-regional area. The cancer may have gone to liver, may have gone to the other parts of the abdomen, may have gone to lungs, bones, etc. If it has gone beyond that area, I think it is very difficult to cure. The only thing which we do in those cases is make the patients' lives more comfortable, and so that they can live longer. By longer, I mean to say, if nothing is done, for example, in stage 4, they may live for about maybe few months, maybe 5-6 months. But if we do something in the form of chemotherapy, targeted therapy, immunotherapy, nowadays so many therapies are available, and if we do those, then most of the patients live for 2 to 3 years, sometimes more. This is I'm talking about an average. So that means many patients may live much beyond that.
Correct. So, like we know that today there is a interconnection or a correlation which is between the environment, the food, the lifestyle and cancer. So could you talk a little bit about those correlations, or how all these factors also contribute to cancer?
Yeah. So in cancer at large, as well as in this colon cancer, there have been many studies which have been done. To find out the causes of cancer. See, there are two types of causes of cancer. One type of cause is which we cannot correct. For example, somebody is like has a family history of cancer. You cannot correct it. You have a family. You have a family. You cannot do anything about that. If you have something wrong with your genes or with your chromosomes, with genetics, nothing can be done for that. So this is there, so that will be there. But what can be changed? For example, if somebody is obese, you can get rid of obesity. If somebody is smoking or using alcohol, so they can actually cut down on alcohol, or they can quit smoking. So these are possible things. uh, the other important thing which is probably modifiable is the diet. And it has been seen that I was just going through literature when I was preparing for this talk, and I was going through literature, just to update what is happening all around. So there have been many studies from long time, not that recently. So long time people have been, checking, what is it in the diet which is probably helpful or which we should avoid. And there are many such things. One most important thing is that it has been seen that the more vegetarian the diet is, the more helpful it is. The less Western or less kind of what is called as processed the diet is, the better it is for the person. So more vegetables, more fruits. Uh, the protein has to be only from the pulses or the legumes, or it can be from the lean meat. So lean meat may be from fish, or it may be from chicken. The other type of meat, that is the red meat, has to be avoided. So, or it has to be cut down, we can say. So it has to be cut down. So that is the point. So the other important thing is that the percentage component of these different diets, these different components of the diet, the macronutrients, that is the protein, the carbohydrate, and the fats. The fats have to be limited, less than 30%. And that fat should also be non-trans fat. I think you will be telling more about that. But what I know and what I have seen is that what the recommendations are. So more and more of low glycemic index foods, more and more of vegetables. I keep on telling my patients that have your platter with the most colors. The more the colors, the good the diet is.
Yes, you're absolutely right. And yes, just to add to whatever you just mentioned. So the first thing is that it's very important to have fiber in the diet, because fiber is, in a way, it cleans and it balances the gut bacteria. And the foods which are rich in fiber, like Dr. Mudhasir said, are whole grains. That means please do not have refined food, maida, suji, breads. So have whole grains, which are much better. Whole grains, there are many kinds of whole grains. There is oats, there is ragi, there is dalia, there is bajra. Even if you want to eat rice, prefer to have brown rice rather than white rice, because white rice doesn't have enough fiber and it is poorer in nutrition. The second thing is have variety of vegetables. Now, the vegetables, like fundamentally, and I must tell you this, Dr. Ahmed, that there was a research done in one of the schools in America, and they asked the students, "What vegetables do you eat?" And all the students tick the vegetable section, saying that we eat vegetables every day. Now, when those sheets came to the teachers, they were confident that no, there's something wrong, because these kids, we have seen, they don't eat vegetables every day. So when they went back and asked the children, what vegetables are you eating? The vegetables they had checked box was tomatoes from tomato ketchup and potatoes from potato chips. And those were the vegetables they had checked boxed every day they are eating. So this is the issue, that today we are not eating vegetables in their natural form. We are eating in a refined form, in a processed form, in a
Correct.
package. And in a package, if you really see, there are flavors, there are preservatives, there are artificial colors, and there are a lot of trans fats also which are there in the packaging. And trans fats, for the lay people, if I can explain. So during World War II, when there was a dearth of real dairy products or butter or things coming from dairy, what the industry did is they passed hydrogen gas through oils and converted into solid fat, like what in India used to come as dalda.
Yeah.
So or vanaspati, or those kind of things. So those are artificial fats. And like in the body, uh, the cis structure is the natural structure. Even the DNA is of a cis structure. The trans is the opposite. So this
Correct.
oil actually had a very opposite structure, which was not natural for the body, and because of that, they started causing mutations, or like what we say, they are carcinogenic in nature. Not only that, they also create more problems for the heart. So the entire heart attacks and heart problems and blockages started coming from the trans fats. And since they were very low budget, so the industry was using in bakery, in cookies, in breads, in every possible thing, they were using trans fats. So that's absolutely right. Trans fats are very carcinogenic. Second thing, which I also feel that in nutrition, the big change is happening is that people are having, like, for example, when they have coffee, instead of having natural coffee, it is like some pre-mixed coffee. uh, Sometimes they also are having compounds in which, like, ready to eat foods, you just put in the microwave and you heat, and they have a lot of preservatives and artificial colors, plus the rise of plastics. And if we see that today we are storing oils in plastic, so one thing which is important is, please don't store oil in plastic, because there is some leakage of the plastic compound into the oil. And especially because India is a tropical country, there's a lot of heat. So when we store these, if you touch a oil bottle in a plastic, you will see it is strange greasy outside, and that
Yes.
is because that there is some contamination which happens if you store in plastic. So best is you buy, and then you convert, and you then pour it into a glass bottle. That is very important. Another thing which is I think very important is that many times when we are storing things, we are storing in non-food grade plastic. Sometimes, suppose you've ordered a meal and a plastic container comes, so you put
Right.
your hot sabzi in it, or you store it, or you keep something like that, and you forget that no, this is not food grade plastic. So there are two kinds of plastic: one is food grade and one is non-food grade. So one should really not ever consume things in non-food grade plastics at all. In fact, many times I have seen that people carry hot things in these non-food grade plastics, which are dangerous for health and not ideal. In terms of oils, uh, again, walnuts, which is consumed in Kashmir, is very good, and all almonds, pistachios, pine nuts, even the very what we say very low cost peanuts or
Mhm.
ground nuts. They are not nuts really, they are legumes, but they are very healthy because these are natural things, rather than say having, like, many times people in afternoon or evening when they're hungry, they have a cup of tea and then they have a bhujia, which is a namkeen bhujia, or those salted snacks. So best thing is, please don't have that. Have natural food or natural things which are healthier. In terms of fruits, you have mentioned very, very well that the color, and the more the color of fruits in your diet, more variety of fruits, they all come with their very powerful antioxidants. So, Dr. Ahmed, the next question would be for you, that when people say have constipation or regular constipation, and many times they keep using some laxative on their own because they feel, oh, I'm constipated, let me use a laxative, and they get it over the counter. So, for maintaining colon health, what are some five or whatever tips you can give so that you have a healthy colon?
Yeah, I think you mentioned rightly that the fiber, the more the fiber diet, more the diet which contains a lot of fiber from plant origin, from the vegetables, the dark green leafy vegetables, and all the colorful things. Uh, One is keep a lot of variety. Do not eat a lot of protein in the diet. uh, there are two aspects of diet with respect to colon cancer. One is, what about the general population who hopefully, God willing, will never have cancer, and another is a population where which who already had a colon cancer, and now we can call them they are survivors, or
Yes.
they are still taking some treatments. So these are two different populations. For a general population, I would suggest that the dietary advice which you said, they should follow it, and they should have a lot of fiber and salads. See, even if somebody is having vegetables, we have to know, we have to understand that the amount of vegetables is also important. We say we should, normally it is recommended that about 5 servings of vegetables and fruits should be there for per day. Serving does not mean kind of one chip of one chip of this and one chip of that. It doesn't mean, absolutely not that. So one, I think serving, you would be better in a better position to tell that, is at least a cup of vegetables, a cup of vegetables, a cup of fruits and different colored fruits, and keep on changing, and use only those, mostly those fruits which are available in your vicinity, not the fruits which have been stored and then brought to you, probably because of the use of those preservatives, etc. Then other thing is that so less of protein, limited amount of protein. Even if you have to take protein, take lean protein. uh, uh, Take small small diet, small kind of amounts of diet at a time. Do not take a bulky diet, like no good big meals per day, you know multiple small meals. That would probably help in decreasing your appetite also in between, because otherwise you will just kind of fast for the whole day and then binge eat everything in the night. So that is also important. So the amount of food, then the type of food, as you said, that it should contain all the micro as well as the macronutrients. So the macronutrients would be carbohydrates, proteins, and fats. And the micronutrients would be vitamins and minerals. So they should be containing good amount of all those. Another important thing is about the salt. So the salt should be, the total amount of salt per day should be contained within 6 grams probably of sodium chloride of the common salt per day. 6 gram probably would be a little more than 1 spoon of salt per day, 1 teaspoon of salt per day. So not more than that should be taken per day. So not like we take like a spray like a lot of salt on our no salted foods, no lots of salted foods. Take mostly steam cooked food, less of fried items. Especially do not reuse oil. I think you touched upon that. I think do not reuse oil. Reused oil means like more of bad oils, more of bad fats. I think that's it.
Yeah, very true. And so tell me, doctor, that that when people are, say, suppose somebody in the family has got cancer, and what are the things which the family member can do? Suppose somebody's father has cancer. So as children, what are the things they should be careful of, or what are the things they can be careful, so that in terms of testing, in terms of early diagnosis, in terms of other things which medically can be done?
Okay, so now we come to prevention, or there's one more term which is called as screening. So screening is detection of a cancer at a very early stage, where the treatment is safe as well as complete, as well as most efficacious. So and screening is detection of the cancer at an early stage, at the stage when they have no symptoms. So before the symptoms happen, you detect a cancer. That is called as screening. So this test, which is done in such a case, is called as screening test. There are recommendations from reputed organizations all around the world, from the health ministries, etc. That we divide people into two groups. One is the people who are at average risk of cancer, colorectal cancer, I mean to say, and there are people who are at a higher risk of colorectal cancer. So who are the people who are at average risk? Average risk means any person, normal person, after the age of 50 would be at more risk of colorectal cancer. So in such individuals who have crossed the age of 50 years, who are average risk, it is recommended that they should be undergoing screening. Now now how to do that screening, how to detect it, what are the tests, which are the good and safe and less costly tests. there are multiple tests. One test is the most commonly used is the colonoscopy, which I touched upon earlier. So colonoscopy is the video. A scope is passed through the anus, and it goes into the intestine, and it looks up to the walls on all sides with the help of a video camera. So this is called as colonoscopy. Uh, if we choose this test for screening, it has to be done every 10 years once. Okay, we start from after the age of 50, and we continue the screening up to the age of at least 75 years of age. Then there are some other tests for the people who do not wish to go for colonoscopy. There are some other tests like the fecal immunochemical test. Then there are fecal occult blood testing. Then there is CT colonography. Then there are some other tests like sigmoidoscopy. Sigmoidoscopy is a shorter endoscope which looks up to only probably some 50-60 centimeters beyond the terminal part of the rectum. And so these are the screening tests. So on an average person has to decide which test to choose. They should be talking to their physician regarding what test to choose. And then there are the people who are at increased risk. So who are the people who are at increased risk? These are those people who have either a known genetic mutation, or who have had a family member. By I mean to say close blood relations. That means first degree family members or the second degree at the most, who have one or two of family members had a colorectal cancer. They should be undergoing the same screening tests, but more often. Okay, so how often? Probably colonoscopy may be repeated every 5 years or so, or every 3 years. And then there are those people who have had a colon cancer but have now survived colon cancer. That means the colon cancer is cured. So how what are the screening tests in those? In those patients, we do the same type of tests. Initially, we do it every year, colonoscopy, and then we slowly change it to like every 2 years, every 3 years. And so these are the screening tests which have to be done in those people. I talked about genetics. So there are certain genetic mutations which predispose the individuals to colon cancer. We do not generally do genetic tests in the general population. We do genetic tests only in those people, only the patients who have a colon cancer or who have a very high risk of colon cancer. That is called as the. If a person who has had a cancer, and then we do a test and we find that yes, he or she is having that genetic mutation which predisposes them to colon cancer, then the next step is to do the family counseling, to counsel the family regarding their risks of colon cancer and what they can do to prevent it, screen it, or treat it.
Correct. And I think that's where counseling becomes so important, because a lot of people, when the first time hear the word cancer, they panic, and then they try and they go around asking and trying different things, and they delay the treatment. So somebody has asked a question that they have polyps. So is polyps something where they are at high risk, or what? Do they have to do some special screening?
Yeah, so as I said that we'll be doing a screening colonoscopy. For example, if somebody does a screening colonoscopy, and on colonoscopy there's a finding. A finding is anything, anything abnormal. So say that this person is having a polyp, or two polyps, or many polyps. So what is the next step? So the next step is actually decided after the first finding. And usually the gastroenterologist who does the colonoscopy, he or she will advise the patient at that time what is going to be the next test. It depends on many other things. It depends on number of polyps, what is the shape of the polyp, how is it attached to the wall of the intestine, how many polyps are there, how many areas of polyps are there. And at the same time, when the colonoscopy is being done, the gastroenterologist may choose to do a biopsy from that polyp. Or if the polyp is very small, he or she may just kind of snare it and take the whole polyp out. So this is possible. So it will be all according to that person, according to the gastroenterologist. The decision, will be taken by him or her at that time what to do. So the next step is usually the biopsy. Okay, and next step is then the evaluation, what to do further, depending
Right.
upon the biopsy report.
Yeah. And now there's another question the person is asking, that if somebody has been diagnosed at IBS, which actually is called irritable bowel syndrome, uh, and which, so in that case, do they need some special screening, or what should be, how should they manage their health?
Okay, so regarding the regarding this irritable bowel syndrome, see, irritable bowel syndrome is a bit different from another condition which is called as inflammatory bowel disease. Okay, so if somebody is having inflammatory bowel disease, for example, some ulcerative colitis or Crohn's disease, ulcerative colitis and Crohn's disease are certainly at an increased risk of developing colon cancer in future. But the irritable bowel syndrome, most probably not. So irritable bowel syndrome, probably not. But if somebody is having Crohn's disease or ulcerative colitis diagnosed by a gastroenterologist, maybe sometimes with pathology, then there is the risk. Then we keep those patients at a higher risk, and they will have to have a more frequent screening tests like the colonoscopy or the other tests.
Yes, yes, correct, correct. Uh, one more question which has come up is that if someone has, say, breast cancer in their family, and they have, they have a delicate stomach, or they keep having loose motions, or so far nothing has come out. Is there anything which they should do, any medicine they should take to prevent cancer? So somebody is asking that question. Or what kind of precaution can they take?
Okay, so here I have to touch on one more thing, which is related to the genetics. That is the cancer syndromes. So genetic cancer syndromes. So there are some syndromes. Syndromes means like appearance of multiple diseases in the same patient or same family. So if somebody is having a history of breast cancer in the family, there are certain syndromes, genetic syndromes, which actually can predispose this other or the same person to colorectal cancer or some other cancers like pancreatic cancer, like prostate cancer, or some other cancers or some cancers of other organs, can happen in those patients. So we have to keep a check on those also, whether there is any susceptibility of or a possibility of genetic syndrome, in such cases. For this particular patient, he or she is just having a history of breast cancer in the family. If they want to just know about whether they can do something, I mean to say, to prevent them from having the same or any other thing, I think this answer is simple. They will be divided from the medical perspective. They will be divided into average risk or high risk. If they should be talking to their own physician and just see that all the parameters and all the history, whether they will be in a average risk or high risk. If they are average risk, then they should follow all the guidelines which are for all other normal individuals. But if they are at higher risk based on the history and the genetic history and other things, then they should be following those higher risk guidelines. Regarding diet, probably I think the diet should be it should be the universal standard diet as which we were talking about. Every person should take this diet. Probably if you want to save yourself from cancer, please follow these guidelines. Probably ma'am will be there. There are many more videos of madam, and she will probably teach you more about what type of diet to take. We have been, like, now past one half an hour we have been talking about what are the diet what diet to take to prevent cancer. So I think this is it, and I will add one more thing. With diet comes exercise. So please go ahead for some good exercising schedule. I think for normal people, what is most recommended exercise schedule is like about 150 minutes of moderate to heavy exercise a week. So you can have kind of 15 or 20 minutes every day, or you can have 30 minutes every day for 5 days and then 2 days off of some heavy exercise or moderate exercise. That would suffice. That has been shown in studies to prevent or decrease the risk of cancer from happening or decrease the risk of cancer from recurring if somebody has already had a cancer.
Absolutely. There is another question which has come up, and the person is asking that they had a piles treatment done, and before that they used to have frequent constipation, for which they used to be taking some laxatives they haven't mentioned. So after piles treatment, is are they more likely to have other issues with the intestine, or is there any connection? So they're asking.
So for simple piles, probably there is nothing else. But at the same time, when they go to the gastroenterologist or the surgeon, they should also be having a normal or an average risk, the screening schedule. So they should follow that screening schedule. Please do not miss that. And sometimes it has been seen very occasionally that something, if something is bad, if something is happening, some cancer or ulcerative colitis or Crohn's disease above insides in some part of the colon or intestine, they may have hemorrhoids, or which is called as piles down. So they may have a pile here and they may have something else upstairs, in the other parts of the intestine. So that has to be taken into account. So if somebody is having just simple hemorrhoids, probably not a big issue. But if the hemorrhoids are associated with some anal fissure, or if there is a fistula which is draining some pus, etc., or blood, then they should be more concerned about that something may be wrong upstairs.
Right. So this is a very interesting question which has come in, and the person is saying that I have been a smoker for over 10 years, and during COVID times I stopped smoking because of COVID, and I take moderate alcohol. I don't know what moderate means because people have different levels of moderate alcohol, but I think he mentions hard liquor because that's the common alcohol which people are taking. So now he stopped smoking, but his 10 years of smoking plus moderate alcohol, is there what can he do now? So he's kind of worried that what should I do now so that I am healthy, I remain healthy.
Yeah, it's a good question. It has many aspects, and one is a silver lining from the COVID that that he has quit smoking. So that's one good thing. The other thing is that he has now a history of smoking and has a history of alcohol intake. Okay, so I would suggest he has quit smoking. That is well and good. That is fantastic. So please keep your spirits high. Do not ever touch the smoke again. Okay, if you are living in Delhi, you will be anyways having your dose of smoke. Okay, so the second thing is alcohol. Please cut down on alcohol also. It is always suggested that no alcohol is better than some alcohol, and some alcohol is probably better than more alcohol. So cut down on alcohol. It is said that that probably a small amount of alcohol may even be beneficial for some cases. It is usually recommended that if somebody has to take alcohol, they should be taking less than 2 drinks a day. Not less than 2 drinks, not more than that. I think people are well aware of what the drink is, how much amount, how much volume, not the 2 bottles, just 2 drinks. So I think he should be cutting down on alcohol. And about the smoking, usually it is seen that many years after the smoke, after the person stops smoking, probably some 5 or 10 years or so, the risk of the individual of having the smoking related diseases becomes the same as the general population. But for the initial few years, there will be certainly an increased risk. Now, but as I said, that no smoking obviously is better. So his risk or her risk will definitely be less than any other, less than what it was before.
Yes. And here I just want to add also that if somebody has had exposure before to smoking, or even people, they eat tobacco, if all those exposures have been there, and if you have left today, then I think it's also important to kind of go on a very healthy diet so that at least you can compensate for some of the damage which has happened. In terms of healthy diet, like we have mentioned that you have to have a lot of fruits and vegetables. Some things which also help are to make your body alkaline, or to, to lubricate your intestine is, firstly, I would say that make sure that you are having organic foods, because foods which are grown using a lot of pesticides or herbicides are themselves harmful in nature. So if you've already had some exposure, then at least you can cut down the further exposure by having organic foods. And organic foods, and even like, for example, if you are vegetarian, very well and good, but if you are eating non-vegetarian, please choose organic poultry, organic dairy, or organic kind of products there, because even a lot of hormones and injections or growth hormones are injected, and growth hormone can be very toxic for the body if taken over a long period of time. Second thing I would say is that some of the things which are very cooling in nature, for example, aloe vera juice is very good for the intestine. Triphala, which is amla, which is based out of amla, is very good for the gut bacteria. Probiotics are very good for the gut bacteria, which you must consume. Similarly, coconut, like a lot of people are scared of coconut, but no, coconut, if you is as a snack, like dried coconut as a snack is very good as a source of fiber. And coconut oil by itself is antifungal, antibacterial, antiviral. So if you're having as a snack small coconut pieces, provided of course that you don't have a heart problem, but if you have small coconut pieces, it actually lubricates your intestine and provides fiber also. So it is excellent on that count. Third thing I would say is drink enough water. And I think I missed talking about water. That hydrating yourself and having at least 1.5 to 2 liters of water every day is very, very important. I know in winters people don't like drinking water, but you can sip warm water throughout the day, because as you hydrate your intestine, it works better. Another thing which Dr. Ahmad has also mentioned, exercise. See, your colonic movement will become imbalanced if you are not exercising at all, if you're completely sedentary. Because even for flatus or gas passing or other things, the intestine needs some movement, the body needs some movement. So that is why intestinal health is connected to your physical health, which is very, very important. One thing which I will, of course, ask Dr. Ahmad is that, a lot of people pop pills. Like, they have a slightest sore throat, they'll take antibiotics. They have slightest of headache, they will take 2 painkillers. And so having these kind of medications, what does it do to the intestine, to the colon? And what would be the right thing to do? Or what is your message?
I think it cannot be emphasized more that we should be using less number of medications, less medications. Do not ever take medicine without a consultation with a proper specialist. If somebody is having some sore throat or things, most of the times it is some simple viral infection, which anyways your antibiotic is not going to do anything. And if you do not take anything, just take maybe some paracetamol for some pain, and take a lot of hot liquids, most of the times it gets over. But if and about the antibiotics, never take non-prescription antibiotics. Never take antibiotics without somebody specializing in that field writing those antibiotics. Never take those. The antibiotics used are harmful in probably two, I can say that 2 ways. One way is that it will increase the antibiotic resistance. So by antibiotic resistance, I mean that some of the bacteria, because most of the times what happens is if somebody is taking an antibiotic, he or she may take those antibiotics not with a proper dose, not with a proper schedule. They may take only kind of 1 or 2 tablets a day for 1 or 2 days, and probably leave that bacteria, if it is there, without with half dead, and that bacteria then will manufacture, will grow, and will have resistance to that same antibiotic in future. That is the big problem. Nowadays what we are seeing is that more and more resistant bacteria emerging, that actually causes loss and causes health hazard to all the people from around, not only you yourself. Then the second thing which the antibiotic does is it kills your normal friendly bacteria in your colon. So there is a lot of normal friendly bacteria in your colon, which is actually essential for you, which actually helps in your digestion. It helps in your in the formation of some of the vitamins, in the absorption of some of the vitamins, and in your proper bowel motions. It will digest some part of that food which otherwise would remain undigested. So it is very important that population of bacteria is very important. So if somebody is taking antibiotics, that person runs a risk of killing those friendly bacteria. And if there are no friendly bacteria, nothing like that, their work is gone. So no minerals, no vitamins, no manufactured those, and abnormal bowel movements. And that will also predispose the person to having abnormal bacteria there, which will cause actually more harm. So these are the important things. So the probably the simplest probiotic would be to use some yogurt, or something that will restore your, if somebody is having a diarrhea, maybe at that time take something so that it can restore your bacteria, restore your colonic bacteria. So they are very important, that colonic bacteria. Yeah.
Yes, I agree. And in fact, I think the questions will never stop coming, but in the shortage of time, there are a lot of people who would like to know more. So I would recommend if we can share Dr. Ahmad's on the screen, the contact details and how to contact Dr. Ahmad, so that you can reach out to Dr. Ahmad on this on Fortis website, and you can fix the appointment and consult. And it is very important that we should not ignore gut symptoms, because it could be something which is small, which is very treatable. And it is not that you have to be scared during the COVID times that, no, I will not go to the hospital or I will catch COVID. No, if you have some symptom, if you have something which is abnormal or something unusual, it is very important to go and talk to the doctors, to consult them, and accordingly you will be advised. So one last question is that there are many people who are scared of stepping out. So are you doing video consultations for people who may want to talk to you but who are still scared of coming to a hospital?
Yes, we are very well doing video consultations. We have our hospital websites for making such consultation requests, and we very well do those. Whosoever is not willing or not or wants to minimize exposure out, I completely agree with that. Everybody should be very careful. Please do not miss your very important visits. But if something can be solved on phone or on video consultation, nothing like that. Please take care of yourself. Please be safe, and please follow all the government guidelines for COVID from a Ministry of Health, India, or any other good recommendation organization. So please follow those and be safe.
Yes. So Dr. Mudhasir, today you have been most articulate about different aspects of the colonic health, and you have touched many topics. And I'm sure people who have been listening in would find it very useful, very beneficial, because we have covered everything which could be affecting a normal population. And of course, we all wish that you stay healthy, and all doctors are here to advise you, support you, help you. And like, if I can share on your behalf, that any diseases, even as dreaded as cancer, if picked up in time, diagnosed in time, can, as you said, that in early stages, it's very curable, very treatable, and which is a big, I would say, achievement of the medical science. So, but make sure that you take early diagnosis and do a proper screening. So thank you so much, Dr. Ahmad, for your time, for sharing so many things. And I hope that our patients are listening in and they would benefit from your knowledge. Thank you so much.
Thank you for inviting me. It was a wonderful conversation. I hope that the people get some help from this. Thank you very much.